I think we'll go ahead and get started. We do have some other folks registered to join us this morning, but to ensure that we get started and end on time, we'll go ahead and start. This is Meredith Coop with Telegen, and I work on our diabetes care team. So today we're going to be talking about insulin pump programs, and we have Carla Saffer on the line with us today, who is going to share a little bit about some information that she learned from Marianne Fedorowicz, and just have some open dialogue about pump training programs with all of you. So glad you can join us. Under our contract with the Centers for Medicare and Medicaid Services, they've tasked Telegen, Medicare's tasked Telegen with helping the state really be able to increase access and utilization of diabetes self-management education services, especially for underserved populations, since we know that utilization of your great services is low. And so that's what brings me here to this work, and I'm fortunate to be able to partner with Inka.
Good morning, everyone. This is Inka Naku, and I work at the Colorado Department of Public Health and Environment. And similar to Meredith's work, we have a CDC grant to increase access and participation in our accredited and recognized DSMS program. And one way we support you all is by hosting these monthly sharing calls as an opportunity for you all to network, share successes, talk about barriers for participants, people with diabetes, to attend DSMS classes. As we all know, the utilization rate for DSMS is low nationally as well as in Colorado, and so it is a reimbursable benefit, and so we are trying to find ways to increase that utilization. Just a few housekeeping rules. Please place yourselves on mute, either by selecting *6 to mute or unmute yourself. Don't place your line on hold. Oftentimes we'll hear hold music, so if you do have to jump off the call, just call back in. When speaking, please state your name. We really encourage in-depth sharing, so step up or step back. There is the chat feature on the right-hand side. If you prefer to chat in questions or comments, we can look at that chat throughout the call. And all of the meetings are recorded, and so we have those available if you do miss future calls or want to look back on past calls.
Thanks, Inka. All right, so we changed this slide up a little bit, but this is where we like to start to get participation from all of you. So we have annotation opened up for all of you, which means you can type on the screen if you're connected by WebEx. And the way you do that is hover your mouse over towards the left side of the screen. You'll get a gray bar and see a squiggly line. Left click on that. Choose a color, something other than yellow if you can. And then click on the text tool, the two T's at the top. Come over to the slide, left click, type your name, your organization, and the city or town that you're calling in from. Once you do that, left click somewhere else on the screen and we should see your name pop up. Excellent. So I see we've got Don Fritz from Salida. Good morning, Sam. We've got Roseanne on the call from TSL. Looks like everybody's saved in the upper left-hand corner. Megan, welcome to both you and Dawn from San Luis Valley Health. Is there anyone on the phone who is not on the WebEx?
Yes, this is Jenny Bardos from MCPN Now Strive.
Good morning, Jenny.
This is Morgan at Good Sam. I still am having trouble with the WebEx.
Hi, Megan. All right, and I see Lisa Bentley is on the line. Very good. Great group this morning. We must have a lot of interest in pumps. So we're going to go ahead and get started.
So our call today, we're going to learn expertise shared with Ray Hospital Clinics and from a national DSMES MNT expert, Marianne Rodowicz. I think you are all familiar with her. And Carla will share lessons, information learned, and how to start a pump training options. And then also we want to identify topics you would be interested in learning more about from a one-on-one technical assistant called Marianne. Through Telegen, we still have that opportunity through the end of July, and so we just are really encouraging you all to take advantage of that. And so maybe out of this call, I'll help you come up with some ideas on topics you could have for those technical assistance calls.
All right. Jennifer, are you still on the line? Jennifer?
This is Jenny.
Oh, it's a different Jennifer. Hey, Jennifer. If you wouldn't mind opening up polling after we read through this slide, that would be great.
Sure.
All right, so our polling question this morning is, to what extent has your DSMES program considered insulin pump training? You currently have a pump training program. You're in the planning phase of developing a pump program, just starting to research pump programs as a possible addition. We do one-on-one pump training that don't have a program. We refer or use pump manufacturers for pump training needs of our patients or other. And if you choose other, please chat in your response or let us know by phone what your response would be. So go ahead and indicate your answer and be sure to hit the submit button.
This is Morgan at Good Sam. We're putting together to implement a pump training.
Thanks, Morgan. How about you, Jenny? What do you have going on with Pumps at Stride right now?
We're just getting started. We've been working with the Medtronic reps, and so we have a handful of patients that are getting started with it.
Very good. Thank you. All right, we'll give it just a second here. Oh, yeah, go ahead, Lisa.
Yeah, this is Lisa with Validate. Yeah, we also have started working with the Medtronic reps, but we work closely with a PA who's does pump training, so hopefully he's going to train us up to be able to start something on our own.
All right, very good. And then a few of you, it looks like, answered that you currently have a pump training program. We have one that says we refer out or use pump manufacturers for pump training needs. So pretty good variation in the status of pump training within all your programs. So should make for great discussion this morning. All right. So as we mentioned earlier, we have Carla on the line with us this morning, and thank her for spending her time with us this morning. If you came to the in-person conference last year in Denver that CDPHE hosted, you may have met her there. That she is a certified diabetes education out in rural Colorado in Ray at the hospital and clinic. And so she did have one of the technical assistance calls with Marianne Rodowicz specifically about pump training and also some other topics. But this morning, just asked if she would be willing to share what she found out. So Carla, I'm going to go ahead and turn it over to you.
Okay, well, thank you for having me on this call today. Let's see, basically what led Ray to pursuing an insulin pump training. So actually this started with from a request from one of our family practice providers to just learn a little bit more about the general pump functionality, because we have patients who come into our emergency room and who use a pump, and the providers really, we just don't, we're a family practice clinic, so we hadn't historically seen a lot of, or worked with pumps a lot. So from a conference that I attended at Keystone, the Barbara Davis conference, I connected with Medtronic, and they connected me with the reps for our area, and from that we were able to have a staff in service that basically gave our nursing and medical staff education on pump training and on insulin pumps in general. And at the time, you know, we're a family practice clinic, and a lot of the more complicated diabetes patients are referred to endocrinology. And at the time, you know, I was kind of under the impression that we're a family practice clinic, insulin pumps are kind of out of our league. It's more of a specialist type device that's used. And really the reps from Medtronic clarified that for me, and that actually now the use of pumps is really being encouraged in people with type 2 diabetes, in addition to obviously type 1. It's pretty standard of care for type 1s, but utilizing them for type 2s is becoming more and more widely used and encouraged. And so from there, I just kind of, you know, went with it, because I thought, gosh, if we do have a large population, as everybody does, I'm sure, type 2s, and we are rural, so the average drive time for patients to get to an endocrinologist is 2.5 plus hours from where we're at. So if we can offer assistance to these patients who have pumps or want pumps, certainly we want to do that in our local community. So I learned more and more, kept in close contact with the Medtronic gals who have offered tremendous support in this effort, and took advantage of the educational opportunities through their web training on insulin pump use, and you know, becoming a pump trainer, and it's just kind of morphed from there. We have, you know, our volume certainly is not anywhere near the metro area. So little by little, we get people who are interested in pumps, in pump therapy, and sharing what options they have as far as that treatment modality for their diabetes. And it's just, you know, it's growing day by day. It's still definitely a work in progress. We're getting things in place, you know, as far as our system goes, with billing and coding and identifying people that would be appropriate for pump therapy. But it really has I think turned into something good that we can offer our patients, and certainly that's based on outcomes that we see people who have gone to the pump.
Carla, can you talk a little bit about what the different options for gaining reimbursement for pump training are?
Sure. So from the technical assistance call we participate in with Mary Ann, basically the options are to either, we have a choice to either bill a person's insurance or contract with the pump company. And currently that is part of the work in progress. The administration is kind of you know, trying to decide what would be the best route to go. Right now, we are billing insurance. You know, it's considered for the Medicare people. We use the G0108 if they have education hours available. So that piece of it is still a work in progress. But to my knowledge, those are the two options that you have.
And so you have to do either one or the other, is that right? You either are reimbursed through the pump manufacturer or you bill insurance.
Correct. And
very
honestly,
good.
Yeah. Oh, go ahead.
No, I'll let you go ahead with what the point you had.
Okay. I was just going to say, you know, insurance companies are. I haven't had one insurance company yet that has denied pump therapy as a treatment option. You know, as long as the person qualifies, because the research shows that pump therapy works. And so even for people with type 2 diabetes, they are getting approved. CGM is another story for type 2s, but insulin pumps, they are getting approved.
And are you finding with the different insurances that reimbursement guidelines and regulations are pretty consistent between the different insurance companies, or do they vary quite a bit?
No, they're basically the same. It's like they follow suit with Medicare, with the Medicare requirements, as far as what I have seen so far.
So we will have a chance. We're going to go into facilitated discussion, and any of you that have questions certainly will have a chance to ask those of Carla. You can also type them in the chat function if you'd rather. But let's just have dialogue about pump training and what that looks like for you. So I'm going to actually turn it over to Inka for this portion of the call.
Hi, everyone. Well, that was really great, Carla. I learned a lot. I was really excited for this call. So I just wanted to kind of gauge from the group, just have some questions on the side. One thing that works well for me regarding pump training, so some of you are doing it, maybe before doing it, pump training, anything that intimidates you, that when you started the process, or if you're not doing, what intimidates you? And then what are you curious about when it comes to pump training? So we'll capture these thoughts on the WebEx, and that way I can share them in the call notes, and then if Carla can answer any questions, we can incorporate that into the slide as well.
This is Kim in Durango, and I have, we already do a pump program. And what we do is we have contracts with all the different pump companies for the initial training. So we get reimbursed through that contract, and then we use the G-codes for follow-up for the first year or so. Otherwise, if we use our G-codes for the training, sometimes we don't have enough hours available for the follow-up.
Gotcha. So you're using your individual hours to do the pump training, and then because it's limited to 1 hour,
the pump contracts will reimburse you a set fee and expect so many hours in return for that fee that's there. So like a Medtronic contract, they'll give you a fee for the pump training, for the CGM training, and then if they're on the 670, they'll give you a fee per hour on the auto mode training. So all of that is kind of included, and they give you an idea of how long that should take. So the patient is getting that benefit from the company they buy the pump from, and then after that, we see them in follow-up for the G-codes.
Okay. Thank you.
Oh, so does that mean technically you're doing both? You're contracting with the company and you're billing insurance?
Yes.
Because
we're not. Yeah, the follow-ups are the G-codes. So that's after all the the training is completely done. We're just troubleshooting issues that they're having or adjusting settings, different things like that.
Okay.
So Kim, it's just that you're not billing insurance and being reimbursed from the pump company for the same service on the same date. You're
Right. When we bring them in for pump training, they're not billed. Their insurance is not billed for that.
It's the company that you bill.
Yeah.
Yeah. The reimbursement that.
So
Okay.
when you do that, does Medtronic or whoever you're working with, do they help facilitate the coverage of the actual insulin pump with the insurance company?
It's all in the selling contract. So if the insurance company approves a Medtronic pump, they do not turn around and bill for my training. It is included in the initial sale of the pump.
So did your facility have like a contract negotiator that they worked with the insurance companies to or the contract negotiator for the pump company?
No, the pump companies all have their contract, and they send them to the CEO or chief financial officer of your organization. They sign off on it, and then we submit each training, our paperwork in. They send us a check, and then at the end of the year, they provide the hospital with a 1099.
Okay. So did you go through the pump training to be a pump trainer through Medtronic?
Yes.
Okay.
We have 3 of our 6 associates that are insulin pump trainers for 3 different pumps.
Okay. For Tandem, Medtronic, and
Omnipod.
Omnipod. Okay.
Do you know what the qualifications are to become a certified pump trainer? Like, who would be qualified to go through that training?
A CDE, so an RN, RD, CDE, and then nurse practitioners and doctors.
And a PA, too, right?
PAs, yes.
Yeah.
Oh, and pharmacists.
Thank you.
Pharmacists, I think, have to be a CDE along with it, though.
Kim, this is Meredith. I'm just trying to capture that on the slide. Would you mind repeating those? Pharmacist, CDE, RN.
Dietitians that are CDEs, and then pharmacists that are CDEs.
Thank you.
For those of you that are on the call that don't have pump training programs, what are some things that are holding you back, intimidate you? What resources can we provide moving forward?
This is Jenny from MCP and Stride. And I think for us, one thing that's been extremely helpful is we've been working with the individual reps from Medtronic, and so they have been offering, to provide training for us and just walk us through the process. So I know from our perspective, having that individual coaching on our end is extremely valuable.
This is Carla. I would agree with that totally. Medtronic has they have been with us from day one, really, when we figured out that this was well within our reach, and have continued that support. And I think as our program grows, it seems like the companies are willing to offer that support. So in the beginning, I thought, to me, I thought an insulin pump was like I said earlier, kind of a specialized device that was used, in specific cases, and really, it's definitely, it can be applied and be successful, even in a family practice clinic. So.
Great sharing this morning. In the spirit of time, I'm going to go ahead and move us on to the next slide because this says Marianne has been a resource for pump training. She's available in a lot of other areas, and so Inka and I want to always be mindful of what resources are most useful to you. So on this slide, Inka, if you want to walk through this real quick.
Sure, yeah, I just wanted these are some of the topics we have come across that Marianne is an expert in. She's an expert in many things, but from the conference and then from our technical assistance calls that we've had over the last year and a half. So if you were having coffee with Marianne, which ones of these pop out at you? Creative patient education teaching tools, marketing strategies, examples of CQI projects involving DSMS M&T participants in improving our program, establishing a new ADA or ADE DSMS program, how to know if our DSMT M&T claims are being denied, creative ways to increase our program's revenue, opinion on the documentation methods we are using, decreasing no-shows, what and how to best communicate with referring providers and leadership to demonstrate our program's value. Or anything else that you want to ask her? And I can provide this information in the call notes, so when you receive those, you can, just one that pops out at you as you start to think about it. So just because of time and the great discussion we had, we'll just kind of wrap up the call real quick because I do want to get to the conference. So everyone, it's June 7th, Friday, June 7th, 2019. I'm actually going to be sending out the registration link today, so I really hope you can all make it. It's free all day, 7:30 to 4. Really 7:30 to 8 is like breakfast, and then 8 to 4 are all the topics and the speakers. It's going to be at the Lowry Conference Center, so the space is a little bit more conducive for a conference. That's some of the feedback that we got last year, is that the space that we had here at the health department was a little tight, so I got a bigger space. And 6 CE credits pending with AADE and CDR, and so I will know if that was approved in about a month, so I can let you all know, but hopefully 6 CEs for you all. Reimbursement for mileage and lodging for those that are traveling over 70 miles one way. So we really encourage you all to come. I'm really excited, so look for that email today. And next call is, again, third Wednesday of every month, 8:30 and noon. And again, we're going to continue with the spotlight on you. Learning about what's been working well, and so we'll have another guest speaker like Carla this morning and this afternoon for next month. So stay tuned. And of course, we have resources for National Diabetes Prevention and the technical assistance calls with Marianne. And then if you wouldn't mind, on the right-hand side, the evaluation will pop up for this call. So please take a minute to complete that. And then the slide always has resources available. And then, of course, Meredith and myself are resources to you at any point. So, great call this morning. Went by so fast.
It did.
That's always does.
And Carla, thank you so much for your time this morning, and thank you everyone else for contributing to the conversation. We appreciate your feedback.
Thanks, Meredith, and Inka. We'll talk soon.
Yep.
Thanks, John.